When you think about healthcare, it's easy to picture a pretty simple exchange, right? You get sick, you see a doctor, and hopefully you get better. But behind that one interaction, there's this massive, sprawling ecosystem with just countless moving parts. It's a world that's way more complex than most of us ever realize. So today, we're going to pull back that curtain and ask a really big question. In this huge network, who's actually in charge?
So, just take a second and think about it. Who do you think really calls the shots? Is it the doctor in the white coat who's making the diagnosis? Is it the giant insurance company that's either approving or denying a claim? Or maybe it's some government agency setting the rules for everybody else? Well, as we're about to see, the answer isn't quite that simple. You know, to really get our heads around this, we need this key concept from our source material. Healthcare is what's called a complex adaptive system. I know that sounds super technical, but stick with me, it's actually a pretty simple idea. Think of it like a rainforest. There's no CEO of the rainforest, right? Instead, its whole life emerges from the constant interactions between thousands of different plants and animals. Well, healthcare is pretty much the same. Its direction is shaped by the push and pull of all its players, not by one single leader calling all the shots. Okay, so if healthcare is an ecosystem, we gotta ask, who lives there? Who are the key players whose interactions define the whole game? Let's meet them. First up, and you could argue most importantly, we have the patients, their families, and their advocates. And really, that's all of us at some point in our lives. We are the entire reason this system exists in the first place, and what we want is pretty straightforward: high quality, safe care that we can actually get to when we need it. Next, you've got the providers and the educators. These are the hands of the system: the doctors, the nurses, the pharmacists, all the hospitals where they work. And this group also includes the medical schools and universities that are training the next generation of clinicians. Their focus? Delivering that care and pushing medical knowledge forward. Of course, someone has to pay for all of this. And that's where the payers and funders come in. They're the financial engine of this whole ecosystem. This group includes your private insurance companies, big government programs like Medicare and Medicaid, and even the employers who provide health benefits to their teams. They're the ones managing the flow of money.
And we can't forget the people who actually build the tools of the trade. These are the suppliers and innovators. We're talking about pharmaceutical companies creating new drugs, manufacturers making everything from pacemakers to MRI machines, and all the research foundations that are funding the next big breakthrough. And finally, kind of holding it all together, we have the regulators and policymakers. Think of them as the referees in the game. These are government agencies like the FDA, which decides if a drug is safe, or professional groups that set the standards for care. They create the rule book that everyone else has to play by. Now, what's really fascinating is when you lay it all out like this, you see everyone's main goal. Patients want the best care possible, providers want to deliver it, payers need to manage costs, suppliers want to innovate and, sell their products, and regulators are all about safety and standards. And bam, right away, you can start to see where things get tricky. None of these goals are bad, but they definitely don't always point in the same direction. So how do all these different interests actually play out in the real world? Well, that's where you see this incredibly complex web of influence start to take shape. Because when you have this many powerful groups, all with different priorities, just navigating their competing interests becomes the central challenge of the entire system. This quote from our source material just nails it. Everything, and I mean everything that happens in healthcare, the quality of your care, how much it costs, whether you can even get it in the first place, is the result of these groups pushing and pulling on each other. Quality, cost, and access. Those are the three big battlegrounds.
And this is a perfect example of a classic conflict. So imagine a patient is fighting a rare cancer. Their doctor recommends a brand new, cutting-edge gene therapy. From the patient's perspective, it offers real hope, and the cost is secondary. But the payer, who's managing a budget for thousands of other patients, sees a $500,000 price tag. They have to ask, is this a cost-effective solution for our entire group? See, neither side is wrong, but their goals are in direct opposition.
And just to make it even more complicated, think about this. That new therapy the patient wants, a regulatory body had to approve it first, and they set really tough standards for its safety and its effectiveness. That one decision influences what the doctor is even allowed to prescribe and what the payer might be willing to cover. The regulator acts as this powerful third party that shapes the whole conversation.
So with this tangled mess of competing interests, you have to wonder, how does the system not just grind to a complete halt? Well, the answer, it turns out, lies in the art of engagement. In a complex system with no single boss, Talking to each other isn't just helpful, it is the only way to move forward.
So why is effective engagement so critical? Well, for one, it builds trust between all these groups, which is absolutely crucial when people's health and a lot of money are on the line. It also sparks collaboration to solve the big problems, helps manage all the inevitable conflicts, and it just makes sure everyone is aware of the different pressures and viewpoints in the room.
And look, this isn't just about getting everyone in a room for a meeting just for the sake of it. There's actually a science to this. Decision makers in healthcare use a really specific technique called stakeholder mapping to strategically plan out how they're going to interact with all of these different players.
And this isn't guesswork. It's a methodical four-step process. First, leaders figure out everyone who has a stake in a decision. Simple enough. Second, they map them out. Who has the most influence and who cares the most? Third, and this is the hard part, they do the work to truly understand where each group is coming from. And finally, they build a specific plan to engage with each one, whether that means full-on collaboration or just keeping them in the loop.
All right, let's zoom back out for the big takeaway here. Understanding this complex web isn't just some academic exercise. It is absolutely essential for understanding why healthcare works the way it does, and more importantly, how we might be able to improve it.
And if you want to grasp just how high the stakes really are, think about this number for a second. Healthcare makes up 10% of the entire world's economic activity. Let that sink in. That is 1 out of every $10 generated on the planet. This isn't some niche industry. It's a massive, fundamental part of our global society.
And this brings us right back to our central idea. In a system this huge, this complex, no single player, not the patient, not the doctor, not the insurance company, can see the whole picture. Real, meaningful progress only ever happens when all these different groups find ways to collaborate and work toward common goals.
So I'll leave you with this final thought to chew on. In an ecosystem that has so many valid but often competing voices, who do you think should have the most influence? The patient who has to live with the outcome? The doctor who has the expertise? The payer who foots the bill? Or the regulator who's there to ensure safety? There is no easy answer, and that right there is the central challenge of the entire healthcare ecosystem.